Have you considered that your emotional state before surgery could determine how quickly you heal, how many complications you face, and even how much you pay afterward?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster. Today we're examining how depression strongly influences surgical recovery and healing outcomes. You'll hear what recent research shows about complication risks, hospital readmissions, and costs, and the concrete steps you can take to strengthen your mind and body before an operation.
I'm Alara Sky. Depression isn't just a mood issue. It affects how you generate energy at a cellular level. When you feel fatigued, foggy, and unmotivated, it often reflects that your cells aren't producing enough energy. That deficit weakens immune defenses, heightens inflammation, and slows repair. The result is longer recoveries, more infections, and higher bills after surgery.
A large study of older adults with colorectal, hepatobiliary, and pancreatic cancers underscored the stakes. Among 32,726 patients, those with depression experienced tougher recoveries, higher complication rates, and worse survival. Costs told the story too. Patients without depression averaged about $17,551. Those treated for depression averaged roughly $22,086, and untreated depression reached about $24,897, showing that unaddressed mental health drives both poorer outcomes and higher expenses.
The authors emphasized integrating mental health into surgical care. Understanding your risk profile enables more individualized plans that anticipate and prevent complications. If you're preparing for surgery, that means your mindset isn't a side note. Addressing depression ahead of time improves resilience, shortens recovery, and reduces costs. Healing starts before you enter the operating room.
Spine surgery research points in the same direction. A meta-analysis of 26 studies found that depression was linked to a sharp rise in surgical and medical complications. Delirium risk nearly doubled, while blood clots, including deep vein thrombosis and pulmonary embolism, were more than 3 times as likely in depressed patients. These aren't minor findings. They directly affect safety and recovery quality.
Infections and neurologic complications also increased. Depressed patients had higher odds of surgical site infections, urinary retention, and urinary tract infections. The likelihood of neurologic injury was markedly higher as well. Even when hospital length of stay looked similar, readmissions were 35% higher, and reoperations twice as likely if depression was present. Evidence that difficulties continue after discharge.
Mechanistically, depression drives systemic inflammation and disturbs hormonal balance. Chronically elevated cortisol slows wound healing and can raise blood pressure. When inflammation runs high and immune responses are blunted, you're more vulnerable to infection, slower tissue repair, and pain that lingers. These pathways show why mood disorders translate into physical outcomes.
So the first step is confirming that surgery is necessary. Ask detailed questions, consider a second opinion, and understand all available options. That evaluation helps you regain control of the decision-making process, which matters when depression fuels helplessness. Feeling in charge is the beginning of recovery, and it sets the stage for the practical steps that follow.
Diet is foundational. Removing seed oils and ultra-processed foods helps reduce inflammation and supports mitochondrial function. Linoleic acid in common vegetable oils accumulates in tissues and stresses cells. Replace oils like soybean, corn, sunflower, safflower, and similar blends with saturated fats such as grass-fed butter, ghee, or tallow. Aim for less than 5 grams of linoleic acid daily, and ideally under 2 grams.
Gut support is next. Your gut and brain communicate continuously, and an imbalanced microbiome amplifies inflammation and worsens mood. Start with easily digestible carbohydrates, fruit and white rice, to stabilize energy. As digestion improves, add root vegetables and well-cooked legumes, then introduce whole grains your system tolerates. This stepwise approach prevents flare-ups while rebuilding resilience.
Movement matters, but keep it regular and gentle. Physical activity regulates neurotransmitters and supports energy production. Evidence indicates that exercise can be 1.5 times more effective than common antidepressants for reducing symptoms of depression and anxiety. Begin with daily walks and light strength training to improve circulation and lymphatic flow. A 20-minute walk outdoors is a starting point. Work toward about 1 hour daily.
Sunlight is a daily lever for mitochondrial function. Morning light exposure to your skin and eyes signals your cells to generate ATP and stabilizes circadian rhythms. Avoid harsh midday sun until you've been off seed oils for at least 6 months. This helps limit oxidative damage while your tissues clear stored linoleic acid. Consistency here supports mood, sleep, and healing capacity.
Rhythm and rest, lock it in. Keep regular sleep and meal times to support circadian biology. Dim lights after sunset and avoid screens late at night to help your nervous system settle. Stable routines, lower stress hormones, reduce inflammation, and improve immune readiness. Key ingredients for clean incisions, fewer infections, and steadier blood pressure after surgery.
All of these actions, diet changes, gut support, daily movement, sunlight, and consistent rest, aim to restore cellular energy systems. When energy production improves, your body can manage pain more effectively, repair tissue faster, and defend against pathogens. That's the pathway from a depressed, inflamed state toward a more resilient recovery profile.
If your surgery is scheduled, map a preoperative plan, clarify the necessity of the procedure, screen for depression, and begin the targeted steps we've outlined. If you're undecided, give yourself time to evaluate. Either way, strengthening your mental health before the operation improves recovery speed and reduces the risk of setbacks, readmissions, and reoperations.
Here's your challenge. Over the next 14 days, act on 3 priorities. Remove seed oils and ultra-processed foods, walk outside daily while getting morning sunlight, and set firm sleep and meal times. Track your mood, energy, and digestion each day. You're building the conditions for a safer surgery and a faster return to full function.
Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.